Hello, and welcome to the Natural PCOS podcast, the podcast dedicated to empowering women with polycystic ovarian syndrome through natural approaches. I'm your host, Dr. Samina Mitha, a naturopathic doctor with a passion for women's health and hormones. Each episode, I'll explore the latest insights and my personal experience to help you manage your PCOS naturally. Together, we'll dive into practical tips, inspiring stories, and the latest research to support your journey towards balance and wellness. Let's get started on your path to thriving with PCOS naturally. Hello, everyone, and welcome back to the Natural PCOS podcast. I'm your host, Dr. Samina Mitha, and today I'm talking about cycles, getting that period. I have been through it all when it comes to regulating cycles. Just to take you back, I'm sure a lot of you have experienced this if you have PCOS, where you just keep constantly going to the washroom, hoping that your period is going to be there. You envy your friends who are like, you know what, my period's going to come on January 7th, and I am going to make sure that I go on vacation the week after because I know my period is going to interfere with that vacation. You can get so specific on when you know you actually are going to get that period. And for me, I always wished I had that, cycle regularity that where I knew how to plan my life around this period, but it was never really like that until recently. So I'm going to tell you a little bit about what I've done personally, but also professionally, what I've used in my practice to really help support women who have PCOS, who are really trying to just get that period. And so one of the biggest things is just learning about what actually happens to get a period. When you first start your period, your estrogen starts to slowly rise. It's going to rise until it eventually peaks around ovulation. This peak is going to cause the cervical discharge to come out sometimes, not all the time. But you might see this clear, stringy discharge that comes out. That's cervical mucus that tells you that your estrogen has risen, and soon your LH should rise. This is luteinizing hormone, tells the ovaries to make testosterone. Once that luteinizing hormone rises, it then tells the ovaries within a day or so that follicle that houses the egg is going to release the egg, and that's when ovulation is going to happen. Now, when ovulation happens, that follicle becomes a corpus luteum, and that corpus luteum is what creates progesterone that helps us to, get pregnant if the egg does meet the sperm, and helps with implantation. Say, obviously, you're not, say maybe you're not trying to conceive, then that progesterone is going to decline if you haven't tried that month, or you're just not trying in general. And when that progesterone declines, then your period is going to come. The reason why I just told you all of that, first of all, is the biggest thing to know is that this hormone testosterone, it really interferes and blocks the production of estrogen. And that is the key to really supporting women with PCOS. How do we reduce this testosterone to allow the estrogen to rise naturally to get that ovulation going? One thing we know is that when insulin is high, it can actually increase testosterone, and that can worsen, the ability to get those regular cycles. So focusing on the insulin resistance, things like myo-inositol can help. Your diet, high fat, high protein, lots of veggies, really balancing the blood sugar throughout the day. Those things can really help support a woman who is trying to regulate their cycles for some individuals. Now, another issue is something called DHEAS, not issue, but also I should say cause of the reason why cycles are irregular, especially in women who I've seen a trend who have a leaner, quote unquote, type of PCOS, where they're not this really high insulin resistant person or overweight. And what happens is this DHEAS comes from the adrenal glands, or cortisol can also impact our ability to, get that period going. However, also DHEAS is a precursor to testosterone. So that can also worsen the testosterone and block that ovulation. So sometimes we see that if we lower stress and anxiety, the cycle gets much better. Yoga, for example, reduce stress and anxiety, digestion gets better, and then also hormones also are able to actually be produced and get balanced. So that's another cause. Another thing to really figure out is the thyroid. Sometimes we do find that hypothyroidism is associated with PCOS. And so when we regulate the thyroid's function, the cycles also get regular with that as well. What I have also seen in my practice is using bioidentical micronized progesterone. All of this information research comes from a reproductive endocrinologist in British Columbia. And what she has really, her institute is SEMCOR, and what she has really found is when you put bioidentical progesterone in a suppository form, vaginal suppository, it can actually help the patient to ovulate and get a period. And I've used this on many, many, many patients, and it really does seem to work. When you put in a vaginal suppository, a bioidentical micronized progesterone around cycle day 18 to 20, let's say, in a patient who has PCOS, we do find within a few days the patient will ovulate on their own. And that will get the cycle going too. Now, a lot of people will ask, well, I have to take progesterone forever. Not all the time. When you expose the body to progesterone, it actually, tells the brain, hey, progesterone is here, and it naturally can help to lower testosterone and allow the person to actually regulate their cycles even after coming off progesterone. But there are some people who just need progesterone. Another thing that I found in my practice over the last year is using something called Maca root. And Maca root by a specific company, Symphony Natural Health, they have a product called Harmony Pro. And this Maca root, I've been learning a lot more about it. There's not a lot of research on it. But what it really does is helps to balance every single hormone. And they actually claim that within 1 or 2 cycles, it can help regulate your cycles. We know maca root is really great for stress, anxiety, increasing libido, increasing energy, stamina, all of these really great things that women need. And so I've been using it in my practice over the last year, and I have found that it can be really helpful to supporting women to regulate their cycles as well. It doesn't work on everyone, but it really takes a skilled practitioner to look and see if maca root actually would help a person, and then trying it out and see what happens. Now, I do find that cycles can become very irregular or just sporadic for whatever reason. You get sick, something happens in your life. And so just knowing that it could be from things that are out of your control. And so it's okay if that happens. It's more about really learning and understanding what's going on in your specific body and how we can really learn the root cause of why your cycles are irregular, and then focus on building in strategies, exercise, movement, getting your sleep intact, reducing stress and anxiety, balancing that diet. And then on top of all of that, maybe some supplements that can help supplement all of the dietary and lifestyle changes that you're making. I hope this was helpful. I'm going to give you a little bit of a history. In my case, I found that big thing for me was high DHEAS. So really doing yoga and like these stress management techniques really can be helpful in my specific case. I've also found that using maca root has also been helpful for me to help lower the stress and the anxiety and, support my sleep and my energy. And that's helping to regulate the cycles as well. So, and also I've used bioidentical progesterone, and I found that that is really helpful. I hope this was helpful for you. If you have any questions at all about cycles, please let me know, and I'll see you in the next podcast. Bye, everyone. Thank you for tuning in to the Natural PCOS podcast. I hope you found today's episode insightful and empowering. Remember, managing PCOS is a journey, and you're not alone. For resources, tips, and to connect with our community, visit my website at saminamitha.com. You can also find me on Instagram at dr.saminamitha.nd. If you enjoyed this episode, please subscribe, rate, and leave a review. Your feedback helps me to reach more women seeking support for PCOS. Until next time, take care and stay well.